My name is Candace Gillies, and I am 23 weeks pregnant and a bit. And when I was 19 weeks pregnant, I went in for a fetal echo ultrasound, um, so they could look at my baby's heart better. And they found that my baby has what is called interrupted aortic arch. So what that is it's a narrowing of the left ventricle, and the right ventricle is enlarged, and the valves to the heart are not how they are supposed to be shaped. Um, so I have a lot of paperwork from the hospital that they gave me, and um, this is what a normal heart should look like. So as you can see, the left ventricle is a good size, and the right ventricle is a little bit bigger, but it's supposed to be. And then these two valves are a nice size. So this valve right here goes to three, or this aorta goes to three little valves, and that gives blood to the brain and then the body. And as you can see, it's nice and thick. And then you have the right aorta, which goes to the lungs and which hooks onto the left aorta to give blood to these valves. So this is what a normal heart looks like. This is what my son's heart looks like right now. So as you can see, the left ventricle is very small, the right ventricle is enlarged, and as you can see, the right aorta goes up like this, as it's supposed to be, but it's only feeding to one valve, where these valves should be attached to this tube. So the left aorta is working for these tubes, and it's very small, as you can see. So they call this part the interruption, where it's completely separated and needs to be repaired to where these valves will be attached to here. They also said if this part doesn't grow, they will have to do a fancy repair, which is this right here. What they'll do is they'll attach the left ventricle into the right aorta, close off the hole, and then these would be attached here, and then they would have to make their own little tube to here to feed blood to the lungs. I've done a lot of reading on it. So this is what the complicated repair would look like. Left ventricle, the right ventricle, which they would make their own tube to feed blood to the lungs, and then they would repair this right here to where it should be normal and there's no interruption. That's a complicated repair if this tube right here doesn't grow. So I have to go in for a fetal echo every 4 weeks, and I have to give birth in Edmonton. So we will be relocated to Edmonton for up to 7 weeks, they said. 2 weeks before I give birth, and then up to the 7 week point, depending on if he will feed properly or not. Um, and this obviously is an unexpected, but need to have surgery. It sucks hearing it, but they said that as soon as he's born, he goes on this special medication that won't close his heart, and then a few days later he'll have surgery, and then I can take him home if he's feeding well, and he'll be a normal little boy. They said that he probably will be able to join the Olympics later on in life. Now, I am on the GoFundMe site just to raise a little money for travel expenses and food costs while we were in Edmonton. As you know, you still have your monthly bills, and then you have this extra bill. And it would just help, instead of gifts for Gavin or toys, that we could get like food cards or gas cards. Because my husband will still be working in Calgary while I'm in Edmonton, and he'll be traveling every weekend to visit us until we bring Gavin home. And that's expensive. Because gas it's cheap right now, but you don't know in 4 months if it's going to skyrocket or not. Because we would just appreciate that more. I know it's hard asking for a little extra help, but in cases like this, you need a little extra help. And that's why I'm going on the GoFundMe site, and any donation would help, even if it's just a comment saying I hope everything goes well. But I just wanted to explain and show what's going to happen, and so that's the whole thing. For a little baby who's not even born yet, he's got tons of paperwork. If you wanted to do some research on your own of the interrupted aortic arch, they have tons of it on YouTube, videos of what the surgery is going to be, tons of information on it. It is a rare heart condition, but it can be fixed. Without it being fixed and without a special medication, you will not make it. So that's why I'm happy that they caught it early, while he's still in the room, because then we are prepared for the medication and the surgery. And also, they said with this particular heart condition can come a condition called DeGeorge syndrome. It has many different names. It's basically where you're missing a piece of your 22X chromosome. The genetics doctor said that it's becoming more common. They're diagnosing a lot of people with it, and it is on many different spectrums, so you can't even know what it's going to be unless he has it, and then if he has it, you don't know what it's going to be until it grows up. And it could show up at 3, it could show up at 14. You don't know. So that is another thing that we will worry about later on. Right now we're just focusing on the heart and the Edmonton trip. I miss my cats, but they'll be in good hands. but I just wanted to explain that and show you the pictures of what's happening. So in about 4 months, the little baby will be here. And then, but I will keep updated on the progress of my fetal echoes and how it's going with his little heart. And while I'm in Edmonton, I'll probably do a couple of vlogs just to let people know. Thank you.